So people with sciatica usually have it's quite variable, but can have a severe level of pain. The pain going down the leg is frequently, but not always, accompanied by loss of power. So sometimes they'll have tingling, pins and needles and numbness, some weakness when they're walking. I'm Joel Lang, physiotherapist at Absolute. The sciatic nerve is the huge nerve running down your leg. So it's a nerve that's kind of that thick, running through your buttock and all the way down. So sciatica refers to pain down the leg, and there's kind of various options that can cause irritation to that nerve to produce the leg pain. So there are three common causes of sciatica. There are a few other types, but the most common three would be a disc bulge, so a disc bulging onto the nerve, producing the sciatica. You can have a disc rupture, which is the same thing, just a more extreme version where the disc actually ruptures and is constantly compressing the nerve. And also, particularly in the older population, you can get a type of sciatica called foramen stenosis, where basically you get narrowing around the nerve. So the most common type, so there's various types of disc bulge presentations, but the most classic one would be the leg pain is produced by periods of sitting or repeated bending. So they're the postures that cause the disc to bulge more and squash the nerve, and it's often relieved by periods of walking or standing or lying down. So that would be the most classic, not the only type, but the type of sciatica we would see most often. And that history of worsening with flexion-based positions and better with walking usually means with a kind of a McKenzie assessment, they're likely to respond to extension directional-based exercises, which obviously need to be confirmed with their assessment. So disc rupture is a more severe type of disc bulge. So basically the disc rings of cartilage like an onion. When that last ring of the cartilage gets breached, a glob of the stuff inside the disc called the nucleus can come out. And when it comes right through that last ring of cartilage, it typically sits on the nerve. So these people have a presentation that's often easy to pick from the clinical information, even without imaging. So they rarely have back pain. It's usually just buttock or leg pain on its own. If they do have back pain, the back pain's much less of a concern than the leg pain. And unlike the more common scenario where walking relieves the leg pain, these people often have severely limited walking, and walking fires up the leg symptoms. So canal stenosis really should only affect people kind of age 55 or over. It's basically when you get older, you get bony narrowing around where the nerves come out. So that space is called the foramen. And if you get enough narrowing around the nerve, that bony narrowing, so if I just grab something, can basically start to narrow the space around the nerve. And if there's little bony kind of area encroaches on the nerve enough, these people have leg pain, and it's a very classic pattern. So the pain is produced with walking, they get relief with sitting down, the distance they can walk until they need to sit is relatively consistent, and they're usually older people. They're usually happy slouch sitting, they're happy bending, so almost opposite pattern to disc bulge. One of the common patterns for sciatica, which is a disc bulge, would be basically how you resolve it would be sorting out any contributing factors. So most commonly the curled sleeping is a problem, so they can sleep on their side still but just straighten the bottom leg, which will maintain the curve in their back. For most of these people, they need correction of the sitting posture into more upright position, but it needs to be checked kind of for each individual. And then most of them will need some kind of exercise, which is usually extension based or extension with some kind of lateral bias. Some of them are purely lateral exercise, which should provide relief. And when they do that exercise, it would reduce the leg pain, sometimes accompanied with a slight increase in back pain initially. Yeah, so the long-term resolution of sciatica would be resolving what type of sciatica it is. So if it's a disc problem, you're going to give specific exercises targeted at reducing the disc bulge, often accompanied with kind of strategies to reduce the aggravating postures. If it was an older person with the stenosis type of pattern, you'll often give them frequent flexion exercises, which basically open up the space around the nerve, and it's often a short-term modification of activity to almost calm it down because they have a structural problem. And then if they have the more brain-driven type of sciatica where other factors are at play, education is one of the key things, as well as exposing them to safely returning to activity.